Very good morning to all of you students. Today we are going to discuss about the plasma volume expanders. They are basically used whenever there is deficiency in plasma volume or blood volume, as in case of excess loss by injury or some accident. Normally, body fluid, 60% of our body weight is water. It is around 42 liters. Amongst it, in the intracellular part we have 40% of body weight, that is 28 liters is in the forms the intracellular fluid, and rest 14% of the total 42 liters forms the extracellular fluid. Amongst the extracellular fluid we have interstitial fluid, 15% of body weight, that is around 11 liters. Blood plasma, 5% of body weight, that is 3 liters. 75 to 80% of extracellular fluid is in interstitial part, so it is mainly interstitial fluid. Blood is a fluid connective tissue that circulates continuously around the body, whereas plasma is watery fluid devoid of blood cells, and serum is plasma without clotting factors. So the basic difference between the blood, plasma and serum is blood is whole plasma plus blood cells. Plasma is blood minus blood cells like RBCs, and serum is plasma without clotting factors. So serum, because of the deficiency of clotting factors, serum is not able to coagulate. Now the concentration of different ions in fluid, plasma, interstitial fluid and intracellular. Sodium is 142, potassium is 4.2, calcium is 1.3, chloride is 108. These are the in the plasma, levels in the plasma. Whereas intracellularly, all of you know, sodium is less, potassium is more. So sodium is 14, potassium is 140, calcium is 1, chloride is 4, like that. So this is the distribution of electrolytes in different body fluids: plasma, interstitial and intracellular. Interstitial and plasma, they together form the extracellular fluid, and whereas intracellular is 40% of body weight. And now the next slide, our main topic is volume expanders. This was the background. How much is intracellular fluid, how much is extracellular fluid, what is difference between blood, plasma and serum. Now volume expanders. Volume expanders are the intravenous fluid solutions that are used to increase or retain the volume of fluid in the circulating blood. Generally, they are used to replace the fluids that are lost due to some illness, trauma or surgery. They do not carry the oxygen, whereas whole blood, because of the presence of blood cells, carries the oxygen also. Now, type of volume expanders. Volume expanders are basically divided into two: colloids and crystalloids. Crystalloids are mineral salts, means sodium, potassium, magnesium, lactose. They are the crystalloids. So the example of crystalloid volume expanders are normal saline, dextrose, Ringer solution. Whereas colloids, they are insoluble, larger molecular weight substances like dextran, albumin, gelatin. Blood itself is a colloid. So colloid are basically larger molecular weight and they are able to retain the fluid better. So colloids are better than crystalloids. Why they are better? Because the larger molecules of colloids are retained more easily in the intravascular space and increase the osmotic pressure, by virtue of which the volume in the intravascular space is increased. So if we have to give plasma or some volume expander for the resuscitation, then crystalloids are also used, but colloids are better. Another advantage is they are relatively longer acting than crystalloids. Ideal properties of plasma volume expanders which should be present in are they should be isoosmotic with plasma, they should be distributed to the intravascular compartment only, they should be pharmacodynamically inert, non-pyrogenic, non-allergenic, no interference with blood grouping, because at times of injury sometimes we have to give the blood also for the clotting factors or oxygen, stable, easily sterilizable and cheap. But none of them has all the properties. So till now what we have done? We have done about the total body water forms 60% of the body weight. Extracellular and intracellular, we have two compartments. Extracellular forms 20% and it has two parts, interstitial fluid and plasma. Plasma forms the 5%. Difference between the blood, plasma and serum: blood is whole blood having both plasma as well as blood cells, whereas serum is plasma minus clotting factors. Two type of volume expanders are there, crystalloids and colloids. Colloids are high molecular weight, mainly protein like albumin, dextran, gelatin. Blood itself is a colloid. They have advantage over the crystalloids, which are basically the ions like sodium, potassium, magnesium and a mixture of these, that they are longer acting, they retain water more and more effective also. Now we will discuss in brief about all of them. Colloidal, as I have already told you, they are high molecular weight. They are like human albumin, dextran, degraded gelatin polymer also known as polygelatin, hydroxyethyl starch and polyvinyl pyrrolidine. Out of them, polyvinyl pyrrolidine is less used, but albumin is very commonly used. Dextrans are also used. Polygelatin and starch or hydroxyethyl starch are also used. Mechanism of action are they all work on the principle of osmosis. By increasing the osmotic action, they draw the blood into the they draw and retain the blood into the intravascular compartment. They increase the plasma osmotic pressure, draw water into the plasma from the interstitial fluid. अब ये fluid आता कहाँ से? Interstitial fluid से. And since the lost blood is replaced with a suitable fluid, the now diluted blood flows easily, even in small vessels. And more oxygen is released not because of the presence of RBCs but because of certain chemical changes where deficiency of oxygen releases more from the available red cells only. Important points are they replace fluid to increase volume as RBCs are still sufficient. अगर एनीमिया है तो केवल फ्लूइड देने से काम नहीं चलेगा. Then we have to give the whole blood. They are useful only when the RBCs are in sufficient number to meet the requirement. Molecular weight of colloids determine their duration of action and ability to expand the volume. जितना ज़्यादा होगा उतना ज़्यादा increase होएगा. Dextran, methyl starch have negative impact on coagulation. They can cause acute renal injury and allergy also. ठीक है, we will discuss this point later on in detail. Now we classify colloids into natural and synthetic. Albumin is the natural one, rest all belong to the synthetic category: gelatin, hydroxyethyl starch and polyvinyl pyrrolidine. Albumin is the only natural colloid. It is the most abundant protein in human plasma, with the total body content of around 4 to 5 gram per kg. It has a molecular weight of 69 kilodalton. It accounts for 70 to 80% of total plasma colloid oncotic pressure. It means normally also albumin is responsible for the oncotic pressure in plasma. Another feature of albumin is that it can bind to cation, anions and toxins like bilirubin, excess of bilirubin. So it is useful to maintain the acid-base balance of the blood also. Another advantage is it has a longer mean half-life of 14.8 days. So it's longer acting. And it is used for the prognosis also. If the albumin level is decreased, it indicates certain pathologies, because mainly it is synthesized in the liver. So probably liver is not functioning well. So the basic features, if we summarize about the albumin, it is the most abundant protein, responsible for 70 to 80% of the oncotic pressure. It has other advantages also for buffering the acid base disturbance and as a prognostic factor of liver function and longer acting. Human albumin, it is basically when we give as expander, it is obtained from the pooled human plasma. We separate it from the pooled plasma and then it can be used without regard to patient's blood group. This is the main advantage. We don't have to look for the matching of the blood group. It can be given to any of them persons and also does not interfere with coagulation, does not cause the hypercoagulability or hypocoagulability. It is free of risk of transmission of hepatitis also, because the preparation is heat treated, so the virus is not there, and that is why a lot of advantages. It mimics the normal oncotic pressure. It is still the first line plasma volume expander colloid. Another advantage is that it can be used in acute hypoproteinemia, liver failure, because the liver is not able to synthesize it. Dialysis. The disadvantage is it is comparatively expensive. And caution what we have to take is crystallized solution like normal saline, GDW, they should also be given along with it for optimum benefit, because it will increase the oncotic pressure. But if the after a certain limit, we require to give water from outside for its support. Now it is available, all of the plasma expanders, they are given by IV route. They are available as iso-oncotic 4 to 5% solution for intravascular volume expansion or hyper-oncotic. So they are available in both concentration, iso 4 to 5% and hyper-oncotic 20 to 25%. Next we come to the it is important benchmark, because biological therapy in terms of pathogen safety remains unchallenged as an additive stabilizer for other therapeutics like recombinant proteins and monoclonal antibodies. And the so-called new generation formulations of these therapies, which exclude albumin, are not supposed to be advantageous, because because of less risk with albumin. So it is just a marketing strategy and no proven advantage of newer generation formulations of these medications, which are called albumin free, are useful. So this was about the albumin, which is the main colloid given as plasma volume expander. Second group is dextrans. They are basically the polysaccharides. Dextrose is sugar, so they are polysaccharides derived from sucrose, beetroot, by the enzyme, by the bacteria Leuconostoc mesenteroids. They are available in three forms according to molecular weight: for dextran 40, 60 and 70. 40 is available as 10%, 60 and 70 as 6%. 60 and 70 are higher molecular weight. Dextran 70 has high molecular weight and it is the most commonly used preparation. It expands plasma volume for nearly 24 hours. Excretion is slowly by the kidney, glomerular filtration, and it has nearly all the properties of ideal plasma except जो advantage albumin में था, but because it was the natural, so it was the most natural one, albumin. Dextran, it interfere with blood grouping, so we have to check the blood. So if we want to check the blood group after giving it, it can interfere, so we should take the sample before, and cross matching, it can also interfere with the cross matching. It can also interfere with the coagulation and platelet function. अब जो भी ड्रग्स प्लेटलेट फंक्शन को अफेक्ट करती हैं, दे प्रोलॉन्ग द ब्लीडिंग टाइम. Third, they can trigger anaphylactic reactions like urticaria, itching, bronchospasm due to the some antibodies produced against the polysaccharide. Dextran 40, it acts rapidly, but because of the short smaller body weight, molecular weight, it is not retained for a longer time, and the limit is it should not exceed 20 milliliter per kilogram in 24 hours. Dextrans as a whole, they have a very long shelf life, 10 years, and are cheap, whereas albumin had the disadvantage of being a costly plasma expander. So dextrans are the most commonly used plasma expanders because of their longer shelf life as well as cheap. And dextran does not provide, caution is, dextran does not provide necessary electrolytes and can cause hyponatremia or other electrolyte disturbances, because we know it is a polysaccharide, so like sugar, it will not provide, so its actions will be like sugar, dextrose, which do not provide any crystalloid. So we have discussed about the two, albumin and dextrans. Albumin mimic the normal plasma volume expanders, have a lot of advantages. They do not interfere with the coagulation, blood grouping, maintain the acid base balance. Available in two forms. They are used in acute liver failure, dialysis also. Less risk of transmission of hepatitis, but the only disadvantage is they are expensive, and at times we need to give crystalloids along with that. Dextrans have the advantage of being cheaper, so that is why they are most commonly used, have a longer shelf life. They need not to be isolated from the plasma as in case of albumin, and they are synthesized by the action of bacteria on beetroot. Dextran 70 and 40, 60, they are the three preparations. Dextran 70 is most commonly used, expands plasma volume for 24 hours. But disadvantages are they interfere with the coagulation and blood grouping. Anaphylaxis can also be produced. Now the third group is degraded gelatin polymer polygelene. Gelatin, we can say gelatins, they are manufactured from bovine gelatin, which is a type of collagen. They are cross-linked and then urea linked, succinylated to form the final products. So basically you have to remember that these are the derivatives of collagen. Molecular weight is around 30 to 35 kilodalton. डेक्सट्रान के अंदर 70, एल्ब्यूमिन के अंदर 69 था. And they have the same advantages like albumin, do not interfere with the blood grouping, cross matching, non-antigenic. Same disadvantage, more expensive, and that is why is used only in selected conditions like priming of heart, lung and dialysis machines. Sercal and Hemacal, they are the name of these gelatins. So in properties basically it resembles like the albumin and is costly also, expensive volume for 12 hours, less duration, so they are used in selective conditions. Comparison now, comparison of gelatins with whole blood. pH wide range 7 comparatively 7 to 7.6, whole blood का 7.3 से 7.4 होता है. ऑनकोटिक प्रेशर, दे बोथ आर आइसोऑनकोटिक. इंट्रावास्कुलर इंटरस्टिशियल फ्लूइड बैलेंस रिस्टोर्ड मेंटेन, दोनों में सेम है. कार्डियोवास्कुलर ओवरलोड अनलाइकली, वेयर एज इन केस ऑफ होल ब्लड इट इज़ पॉसिबल, क्योंकि उसमें तो कॉलॉइड है तो लेस चांसेस ऑफ वाटर फ्लूइड ओवरलोड. एंड plasma half life is only 4 to 6 hours and it gives action for around 12 hours, whereas whole blood it depends on the fraction what we are using. Renal vasculature, renal function is maintained or improved, usually not impaired. Same effect of blood coagulation, dilution, possible factor activation means it can whole blood can cause the hypercoagulability, whereas gelatin dilutes the blood, and because of dilution of the anticoagulants, natural anticoagulants, it can cause the hypercoagulability also, or dilution of coagulation factor, so can interfere with coagulation also. Shelf life is 5 years, whereas in dextran it was 10 years. In albumin it was less than dextran. Whole blood shelf be 3 weeks, we can 21 days around. And transmission of diseases, significant risk like hepatitis B, C and AIDS through the blood, but not with the gelatin, like not with the albumin. Now the fourth group of plasma expanders is HETA starch or hydroxyethylase starch. It is a mixture of ethoxylated amylopectin of various molecular sizes. Average is very high. It maintains the blood volume for a longer period. It does not cause acute renal failure or coagulation disturbances. So these are the advantage. Another uses are, it can be used to improve harvesting of granulocytes because it accelerates erythrocyte sedimentation. तो इसके अंदर भी यूज़ कर सकते हैं हम WBC हार्वेस्ट करने के लिए. हार्वेस्ट मीन्स सेपरेट करने के, इंक्रीज करने के लिए. एडवर्स इफेक्ट्स आर anaphylactoid, mild fever, chilling, flu-like. They are all possible with the any drug given by IV route. Spasm. Next is polyvinyl pyrrolidine. It is less commonly used. 3.5% solution is available. It was used for the trauma victims after 1950s. Disadvantages, it interferes with blood grouping and cross matching and is histamine releaser. So second जो डेक्सट्रान था उसकी जैसे ये इंटरफेयर कर रहा है ब्लड ग्रुप एंड क्रॉस मैचिंग से, एंड इज ऑल्सो हिस्टामिन रिलीजर, सो एलर्जिक टेंडेंसी इज मोर. इट बाइंड्स विद द एंटीबायोटिक्स एंड इंसुलिन, सो नॉट गिवन. इंसुलिन पीवीपी आता है, एंड देन इट इज एक्सक्रीटेड बाय किडनी एंड स्मॉल अमाउंट ऑफ लीवर इनटू बाइल. यूजेज होते हैं इसमें मेनली बेसिकली दे आर यूज इन पर्सनल केयर प्रोडक्ट्स, बाइंडर इन मैनी फार्मास्यूटिकल tablets. These are the uses other than a plasma expander. They are used as binder in tablets, personal care products, combined with iodine to form povidone iodine, known as betadine and pyridine. So we have discussed about the 5 types of colloids. Colloids, they are more advantages in comparison to crystalloids, जो हम next part में अभी cover कर रहे हैं. And they were albumin, normal जैसा होता है, and do not interfere with blood grouping, coagulation. डिसएडवांटेज होता है, कॉस्टली होता है, लेस रिस्क ऑफ ट्रांसमिशन ऑफ इन्फेक्शन. सेकंड था डेक्स्ट्रान. डेक्स्ट्रान में सारे डिसएडवांटेजेस थे उनके अलावा, बट बिकॉज ऑफ द चीप मेंटेन द expand the volume for 24 hours, and most commonly used Dextran 70. Third one was gelatin. It was more like albumin. Fourth one was hydroxyethyl starch. Hydroxyethyl starch जो था उसके अंदर एडवांटेज था फॉर हार्वेस्टिंग द ग्रेनुलोसाइट्स, बट जैसे ये लास्ट में जेलाटिन था, दे वर यूज्ड लिमिटेड. सो स्टार्च जो है दे ऑल्सो एक्सपेंड फॉर 24 hours. PVP वेरी लिमिटेड यूज़, अदर बिकॉज ऑफ देयर इंटरफेरेंस विद ब्लड ग्रुपिंग जैसे डेक्स्ट्रान के साथ होता है, एंड हिस्टामिन रिलीजर होता है. अदर यूजेज एज बाइंडर्स इन टैबलेट्स, लेस कॉमनली यूज्ड एज एक्सपेंडर. पोविडोन आयोडीन बनाता है. एंड एडवर्स इफेक्ट्स ऑफ सिंथेटिक कॉलॉइड्स. Natural was albumin, and rest of them were synthetic, synthesized from beetroot, bacterium, and like that. Coagulopathy, renal failure, circulatory, hepatic complications. Volume substitution with fluids other than fresh blood may be expected to lead to a progressive dilution of cellular and protein hemostatic components. It means they are saying that antithrombin 3, which is anticoagulant, it is diluted because of these colloids, and as a result of this there are chances of hypercoagulation. Albumin causes the coagulation at the 30% of volume replacement, but is not considered to have clinically significant results. Gelatin जो है it also impairs platelet aggregation, so it is avoided in cardiac surgery. Dextran, hydroxyethyl starch, they also decrease the factors 8 and 9. Now we come to the next part. Next part is crystalloids. Crystals means crystal resembling a crystal. Small size होते हैं. They are electrolytes, basically sodium, water, ions, minerals, and small molecules which can diffuse freely. Because of their low molecular weight, they have low tendencies to stay intracellular. मेनली अपने आते हैं सोडियम क्लोराइड. 75 से 80% जो होते हैं दे आर डिस्ट्रीब्यूटेड इन द इंटरस्टिशियल स्पेस. सो बेसिकली दे आर नॉट एक्सपेंडिंग द प्लाज्मा वॉल्यूम एक्सपेंडर्स वर मोस्टली colloids, and they reach the interstitial space and they expand that interstitial volume more. Isotonic saline, lactate, They are the types of crystalloids. They first is isotonic. There can be isotonic, hypotonic, and hypertonic. Where in colloids we saw only the isotonic and hypertonic. There, whereas crystalloids they are of hypo, hyper, and isotonic. Isotonic are they same as plasma, same oncotic pressure, so they can increase the intravascular volume like 9% NaCl, Ringer's lactate, 5% dextrose water. Hypotonic are they are less osmotic, so more fluid will be given and that will be shifted to the cell, so they will hydrate cells more, like 0.4 half concentration instead of 0.9 we have 0.45% NaCl or less sodium chloride. Hypotonic they have high tonicity and they draw water out of the intracellular and interstitial space into the vessels, so they are volume expanders. So for acting as volume expander like in colloids, they should be either isotonic or hypertonic. Here we can see in this table that normal saline, it has normal plasma has sodium, chloride, potassium, calcium, pH, glucose all available. Whereas in normal saline, it has higher chloride, which that is why it can cause the acidosis as side effect. And here we can also see the pH, they are decreasing the pH. Osmolarity of normal plasma is around 290 millimole, and in 9% 0.9% NaCl it is 308, slightly more, but it is still within the 10% change, so we consider it as isotonic and it is used for resuscitation. जब भी फ्लूइड लॉस ज़्यादा हो जाता है तब हम इसको यूज़ करते हैं. Whereas if see the Ringer's lactate के अंदर सोडियम कम है, क्लोराइड भी कम है comparatively, and pH is more in comparison to normal saline, and they have lactate as buffering agent. जबकि उसके अंदर एसिडोसिस हो रहा था normal saline में, but it has no buffering agent. Osmolarity is 293. 5% dextrose water में no sodium, no chloride, only energy. 50 milligram of glucose. Hypotonic, because why hypotonic? Because when we give it glucose, it is metabolized and only fluid remains, water remains. That is why it is hypotonic. And इसको हम use करेंगे when there is condition of hypernatremia, there is more sodium, so we will dilute it because it itself does not has any sodium, so it will dilute the excess of sodium. And it is also used in hypoglycemia because it has glucose in it. So there are different uses. Normal saline and Ringer's lactate, they are basically used for the resuscitation in case of fluid loss, whereas dextrose water is used less commonly, just to give the energy in case of hypoglycemia and in cases of hypernatremia to dilute the higher increased sodium concentration. Isotonic saline, now we will discuss in brief one by one. Isotonic saline, 0.9% NaCl, 9 grams of sodium chloride per liter, osmolarity is 308 milliosmol. When to be given? It is the drug fluid of choice for resuscitation, only fluid used with एडमिनिस्ट्रेशन ऑफ ब्लड प्रोडक्ट्स. हमें कोई ब्लड प्रोडक्ट भी देना है साथ में, आरबीसी सेल्स वगैरह या कुछ. जब हम एल्ब्यूमिन दे रहे थे देन वी नीड टू गिव क्रिस्टोराइड, तो हम प्रेफर करेंगे इसको माइल्ड हाइपोनेट्रीमिया में, क्योंकि बिकॉज इट हैज़ हायर सोडियम कंसनट्रेशन, सो वी कैन यूज इन हाइपोनेट्रीमिया. जबकि हाइपरनेट्रीमिया में वी हैव टू गिव द डेक्सट्रोज. शॉक for the resuscitation, and any low reason for the low extracellular fluid जैसे कि hemorrhage, vomiting, diarrhea, then we give the normal saline. Ringer's lactate, it is also known as Hartmann solution, Potassium and calcium, they are in appropriate concentration. Sodium is less, as seen in this table. Sodium is less comparatively in Ringer lactate. Potassium and calcium are almost the same, whereas in normal saline, potassium and calcium were not present. So, the risk of hypercholoremic acidosis, which was present with the normal saline, is less in Ringer lactate, contraindicated as diluent for blood transfusions, जबकि हम normal saline दे रहे थे. Most physiologically adaptable fluid because its electrolyte content is most commonly related to composition of plasma and serum. Again used for resuscitation, replace fluid in diarrhea, vomiting, burn, trauma. Burns के अंदर this one is preferred, Ringer lactate, not the normal saline. Calcium disadvantages are it can show drug interactions with certain drugs like aminocaproic acid, amphotericin, ampicillin. So they are not given with, these drugs are not given with this Hartmann solution. And if there are chances of acidosis, metabolic acidosis, then we can give them Ringer lactate, but not when the lactic acidosis, because it itself has lactate. Now 5% dextrose in water, 50 gram present in 1 unit, 170 supplying energy of 170 kilocalorie per liter. It is considered isotonic, but when the dextrose is metabolized, it shifts to hypotonic. Less than 10% remains intravascular, and otherwise it is shifted to the intracellular compartment, causing the cellular swelling. It does not replace any electrolytes. Uses are only in hypernatremia and hypoglycemia. Disadvantages are they are not good for renal failure, because cardiac problem, because they will cause the volume overload. They should be avoided with increased intracranial pressure. Again, chances of cerebral edema. Should not be used in isolation to treat fluid volume deficit, because they will dilute the electrolyte concentrations. So we cannot depend only on dextrose water for the replacement. And also do not mix it with blood, because of hypotonicity it will swell the cells and cause the blood cells to hemolyze. Not used for resuscitation. Only Ringer lactate and normal saline, they are used for resuscitation. If they are hypernatremia, then we will prefer the dextrose, and if hypo, then no, isotonic saline. For calcium and potassium, we go for the Ringer lactate. So this was about the crystalloid. So in this class, very brief summary, we have discussed about two types of plasma volume expanders, colloids and crystalloids. Colloids are better. They are have high molecular weight, expand the intravascular volume. Albumin is the best one. It is natural one. It has an advantage of not interfering with the blood group coagulation. Second was dextrans. Third one was gelatins. Gelatins are more like albumin. Fourth one was starch. And fifth one was polyvinyl pyridine. They are not preferred now. And in crystalloids, we had three mainly: saline, normal saline, Ringer lactate, and dextrose water. Normal saline and Ringer lactate, they are used for resuscitation. Normal saline, it has high sodium but no calcium and potassium. It can produce the side effect of acidosis, whereas Ringer lactate has the advantage of acting as a buffer. in case of acidosis, but has also advantage of having the sodium calcium isotonic mainly, and dextrose it supplies only the energy and is used in hypernatremic cases only, and it will expand the intracellular volume more, not given with the blood products where only normal saline can be given because it will hemolyze the cells, and also ringer lactate cannot be given with the blood products. So this was all about the class on plasma volume expanders. Thank you.